Back onto the continent now, and we're back with news from our neighbors. Zimbabwe has recorded 287 cases of COVID-19, and there are fears the number will rise rapidly. The country is in the grip of a tough economic crisis, and quarantine centers are filling up. Let's get you the latest news from that country. I'm joined by journalist Zenzele Ndebele in Bulawayo for us. Thank you very much for joining us, Zenzele. Let's start with the worry around quarantine centers, where we're seeing numbers going higher and higher.
Yes, over the past 2 weeks, we have seen a lot of people in quarantine centers testing positive. And these are people returnees mostly from South Africa and Botswana. And there are fears that conditions in those quarantine centers are the ones that are not conducive for isolation, because mainly people are overcrowded, there is no good hygiene, and people are not isolating. So the doctors for human rights were actually saying that it is the conditions in the quarantine centers that has seen a rise in the number of positive cases, because people could be spreading the virus in these quarantine centers.
Unfortunate conditions in those quarantine centers. We also understand that a number of people have been escaping from those centers. What do you know about that?
Yes, quite a number of people have been escaping from the quarantine centers, because probably from the reason that we're saying that people are feeling uncomfortable. We have talked to some people in the quarantine centers who are saying that it feels like prison. They don't have enough food. They are overcrowded. They fear getting the virus, and sometimes when they are sick, no one pays attention to them. So this could be some of the reasons why people are escaping. But also we have some people who are, convicted criminals who have been convicted in South Africa or Botswana, who are deported, then put in these quarantine centers, obviously for fear of probably being arrested again, or thinking that they might be detected. They end up running away, going back to these countries, or just going to their homes.
How is the situation being dealt with or managed?
Well, they are tracking teams, because when these people, usually when they get to quarantine centers, they write their details and their next of kin. So we've heard stories that some teams actually go to these homes to try and find out. Recently, we saw a list of the people who escaped from the newspapers, and they actually calls to say, if anyone who escapes from the quarantine center comes and hides at your place, you are also going to be taken to the quarantine center. So people are actually calling for harsher conditions for those who protect people who are running away from the quarantine centers, because they are posing a danger not only to themselves but to the community as well.
You spoke about repatriation of some of the prisoners from South Africa and Botswana back to Zimbabwe that are in these quarantine centers, but the numbers that we are seeing gradually rising in Zimbabwe in terms of COVID-19 infections. What else do we put that down to?
Well, we can basically, I think for like what the doctors for human rights were saying, that the conditions in these quarantine centers might not be ideal for people who are quarantining, because there is less isolation, there's less distancing, because people are using the same facilities, same utensils, same dining halls. So it also quite a problematic situation, because we have a number of Zimbabweans who are in neighboring countries who get stranded, and then they ask to be repatriated back home. But then they have to first of all stay in these quarantine centers. So most of the cases that we're having now, they are cases that are coming out from these quarantine centers.
Economically, what is the situation? Perhaps that's the question to ask.
Well, it seems like things are not getting any better. I mean, just from talking to the guys in the street now, the US dollar is going to around 1:70, 1:80 to the Zimbabwean bond. And it was 1:40 a month ago. So the rate, the black market rate is going up, although the official rate is still at 1:25. So as long as Botswana, South Africa borders are closed, there is less economic activity that is happening in Zimbabwe, because these are the neighboring countries that normally people trade with. So a lot of companies still in Zimbabwe are not operating up to full capacity because of COVID, and they have not been operating on full capacity because of the economic situation. So things are not looking good for Zimbabwe when it comes to the economy, because of the COVID and because of the challenges, the political and other issues that we've always had for the past 20 years.
And of course we know that sometimes people get their supplies from South Africa in terms of medicines and food. When it comes to the supply of food, how are things looking like? Are shelves properly stocked up? Do people have access to the basics that they need?
Well, I think the shelves have been a bit okay. There is a bit of food you can walk in and buy, but we've seen the disappearance of basic commodities like cooking oil, sugar, meal. Those are the things that you don't find in most of the shops, and then they're sold in the black market at a very high price. So most people, the Zimbabweans survive on selling, they survive on vending, and as long as the informal sector is not yet open, we will still have challenges that the people who ordinarily will be able to feed themselves are not able to feed themselves. So we've seen a lot of people who need food assistance. So the number has already risen, knowing that, before COVID, we already had 7 million people who needed food assistance because of drought. And I'm sure that number is hitting almost 10 million now because of the COVID situation.
Let's leave it there. Thank you very much for that update. Out in Bulawayo for us, Zenzele Ndebele. Let's take